Look, we not ready. Can you tell we not ready? Good morning. Good morning. Good morning. I got stuff all over my face. All right. Okay. I don't know if anybody they can hear me. Check that mic. No,
It's a delay.
but I still don't hear you. I heard you
You think you need
before.
your headphones in?
But I would be able to. They should be able to hear you. So I have it listed. So if I was a viewer, I would be able to
Okay.
hear, and I don't hear you in that mic. I don't know
But I
why.
hear something.
Say something. Say test, test, test.
Testing, testing,
I hear you faintly.
testing, testing. Okay.
Okay. All right. I think we here. Well, hello. um. Oh, great. Look, we had to do a mic check. My mic sounds nice. Check, check. Oh, they okay. They said she could hear. Okay. Well, good morning,
Yeah, I can hear you.
everybody. Good morning, Renita. Good morning, Tanika.
Good morning.
Good morning, Anita. Look, are we cousins, Anita?
We need
Hold up. I don't
shirts.
even know her. She said you can hear. She can hear. Oh, wait. She said there's an echo. Oh, because I needed to hear. Hold on. I needed to hear. I know. Okay. Is that better? I needed to be able to hear y'all or hear us because I couldn't hear when I was setting up. So hopefully everything is everything now. Lord Jesus. Say hi. We live in Philly, y'all. We live in Philly. We live in Philly. All right, all right. Let's get this party started. So I don't even have to do my look announcement thing. Well, I'll do it all. We'll figure it out. Okay. I'm just excited. Sleepy and excited. All right. Yeah, they had me out late last night. Y'all know I go to bed real early, and they had me out in these streets, in these Philly streets, for real, for real. Okay. Well, welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, hanging out in the streets of Philly, keeping me up all hours of the night, and technology, as well as entrepreneurship and the revenue cycle at large. So as you come in, don't forget to hit the thumbs up or like button. And I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask you, do you know what it takes to be a certified marketable medical coder? You might think you do, but you might not know for sure. So, before I introduce my co-host, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. Uh-oh. Deanna did something wrong. All right, all right. So if you are interested in no, I don't want to do that. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, then check out the video description for the link. So joining me today is my partner in success. Yeah, I stole that. Thank you. I think Renita gave us that. My co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been a nurse for 31 years, And in 2014, I transitioned away from the bedside into medical coding. And in 2020, during the pandemic, I created a company called the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how is that working out for you?
It's going swell.
Yes, it's sweller than swell, for real, for real. Keep it a buck. All right, all right. Well, before we jump in, let me remind you that you can join in and add to the conversation. Again, we bring the topics, but we hope that you feel compelled to have something to say about the topics that we discuss. So don't be shy. Most of you all who have been here with us over the years know that you use the chat to chat with us. So your opinion matters and is welcomed here. So if you have a question, please type Q first so we know that it is a question and we don't miss it. We don't ever want to miss a question. We always want to make sure that we do discuss that. But so for those who are joining us or watching the replay, welcome, welcome. And today we are asking the question, medical coding, are you built for this career? Really? All right, all right, all right. But first, let's get into a little church announcement, shall we? Everybody got their church fan, really. She said, y'all look like Tony the Tiger Gray. Okay. We can't hear it on this end, so we okay. Church announcement. Miss Church, oh, and I'm sorry, I didn't introduce the crafty coder here, our on the street correspondent with her little usher fingers. You can do it in person now. Yes. There you go. Came up here to join us in Philly, live in Philly. All right. So church announcements for today. Oh, hey, Carolyn. Good morning. Good morning. All right. So today, I wanted to talk a little bit about, there's a whole bunch of stuff going on. I think I saw somewhere about the IPPS. I think it's the final just came out. She says you guys are together, love it. Yes. I think the final came out. Final rule just came out with information on physician payments, market share, basket payment, all of those things. If you hear those buzz terms, all of that stuff comes from IPPS. The ICD-10 and PCS codes, any guideline information, and then specifics to the codes, like why they changed this, that, and a third. So I believe that dropped this week, or I've seen some posts from other sources that mention IPPS. So be on the lookout for that. We'll probably dig into that a little later. But I attended a CTRM meeting Wednesday. Those of you who are part of the Patreon, you know this because I let you know. You always get the dibs on all of the things. And one thing I wanted to just talk about, and this is directed to any educators, specifically if you're doing any type of education in a healthcare field. So one of the things that they talked about was the Miller's Pyramid of Clinical Competence. Now, this is relatively new in the education space, and folks have been scratching their heads and trying to figure out, well, what in the whole world is Miller's? So I just wanted to give you kind of a preview Again, especially if you have your own courses or you are in that education space, on some of the things that may be coming down the way, particularly if you're educating in health information that you may need to know. So let me share my screen. Okay, so here is the Miller's Pyramid or Prism of Clinical Competence. And so it's dated, it's from 1990, but it really talks about assessing your student in various levels. And so it's assessing not only their cognition, but also their behavior. And it looks at their attitude, skills, and knowledge, and then grading them from becoming a novice on a particular subject to an expert in that subject. And the four areas that they primarily look at are knows, knows how, shows, and does. And with does being the tippy top of the pyramid. So knows basically says they know something, they know a little something about it, they have some knowledge. Knows how is they know how to apply that knowledge. So in particularly for you all that are designing, building, or even teaching medical coding courses and the like, kind of put a framework around what your curriculum looks like, how do you assess the students. And we kind of talked about some of this a couple of weeks ago when we were trying to figure out, like, how are these people out here coding but don't necessarily know coding. There's a lot of things that are missing with folks that are coming, and not saying that you all are the reason why. We just made some observations. How about that? So just kind of think through that as you begin assessing your students. And then shows means they show how to apply that knowledge, and then does, they actually apply that knowledge in practice. So again, you have the knows, you gather facts. This is your traditional true false or multiple choice questions. The knows how is interpretation and application through case presentations, essays, extended matching type, and multiple choice questions. I don't know what OSCEs mean, but demonstration of learning is in your show. So through simulations, you're showing. So if you give like some textbook kind of cases or case studies, and then performance integrated into practice is your top level, which is the does. And this is through direct observation. So somebody is actually sitting and watching you do the thing. Usually kind of workplace, real life type applications. So actually having, and I think we talked about that, having some real cases that have been redacted where they're actually, going through it, or to your point, an externship where they're in the space doing what the other people are doing. So these are how they will begin to assess folks in health information. And so again, I just wanted to bring this to your, and I can put, I'll put this for our, because we're going to talk a little bit more or in detail about this in the meeting after the meeting, but I'll definitely give you guys will have the link to that as well. So that was the church announcement that I had. And then the other church announcement, you can pretty much see, we here in Philly live. We made it. Some of us had more troubles than others getting here. Good morning. But we made it. Mr. Jesse, did you have any church announcements for the people?
No.
really. Here we go.
I mean, it's a tone.
I know it's the tone, right? Now you getting it live in the person. You, ma'am, you get what I be getting. You, ma'am, I be feeling it too. I be like, really? Okay, well, let's on to the next. Here we go. Look, I got 4 tea bags just in case I was ready. 4 tea bags. All right.
Not that you want to talk about the documentary. Like,
We can. Go ahead.
awesome. Oh, okay. So we're all in Philly. Well, I live here, but we're all here in Philly because last night there was a screening by Raquel Wilkerson Alston, and she has a company, ACD4N, and she hosted a screening last night for the documentary Black in Nursing.
Black nursing.
Black in Nursing. And it was a really, really powerful documentary. I came with no expect. I knew I was going to be educated, but I had no idea that it was going to resonate as well with me as much as it did. And it was well attended. It was well received. There was a Q&A afterwards, and the creators of the documentary were there to answer questions and to share why they did it. And
Talking to Mike, she said you low.
Why they had to do it, or why they did it, or why they wanted to do it, and how much work there is left, because it's not just Black in nursing. That could be extrapolated into Black in healthcare, period. And I really see from the documentary and from the dialogue last night how much community matters and how much support matters. It was really good.
Yeah, I believe your takeaway primarily was support. You were talking about that a lot. Like, it's about the support. It's about the support. And I said this last night. I felt such like the mama bear, bringing all the people together.
Absolutely.
I said, I don't think the mic is on. I don't know. We could hear him at first. Say something.
How about now? I
don't see.
don't think I touched anything.
I don't know. Say some more.
Testing.
I see you. You turning red. I mean, turning green.
Testing.
Okay. Is that better?
Testing. Is it better?
It's blinking. I'm waiting on them to say.
Okay.
Y'all ain't gonna tell us? Oh, much better.
Okay, good.
Cool. So, yeah. So I was just so excited to see one of the co-sponsors of the film, Black Women Cultivating Change, and Ashley Glass, and her partner with the Black Nursing Network. I believe that's the name of it. I'm sorry if I butchered it.
Yeah.
Okay. Came up with the concept for the film, and I sit on the board of Black Women Cultivating Change. And so when I saw, we had a meeting and they were talking about, the film is going to be premiered in Philadelphia. And I'm like, Philadelphia is real random. Why Philadelphia? And it was like, oh, well, somebody heard about us and they was talking, and then they was like, well, this man and da da da, and it's like, it clicked. Like, we talked about it. Jesse was the man. He told somebody else. Next thing you know, we're here in Philadelphia. So I was excited. Turn down the music part. Oh, we still on church announcements. Oh, hold on. Church announcements are louder. My bad. Hold on. I'll just stop it all together. Okay. Even though we are still in church announcements. But anyway, yeah, so it was really good to see. I've seen it. I had seen it before, but just to experience it again with other people who have fresh eyes, and really great insight on their experiences. There were several nurses in the audience, and they supplied their experiences as it relates to being a nurse here in these states, and their educational experiences, as well as the work environment, just all of the things. And it was fabulous. It was wonderful. It was great to see my very own co-host was a sponsor of the event. I think we talked about that before. So his name was up in lights, and it was just cool. It was. To meet Raquel as well. She's friend of the pod. So, just talking with her, and just it was fabulous. It was fabulous. And then afterward, they kept me out all night. Let me just tell y'all, these people, they hang out late. I don't. I be in the
And
bed.
since we have our roving correspondent here, Crafty Coder,
Yeah,
what
what
was
were
your
your thoughts?
thoughts?
I think the biggest takeaway was that the nurse that was 100 years old had the same experiences that someone that just graduated last year. I thought that was like, why? Why? That hurt my feelings. And I'm not even a nurse, but it was just like that's just crazy that it's even we're even still in that type of a situation. And the other takeaway, wasn't Florence Nightingale? Was that the nurse? Yeah. Like, how come she got all the credit and we came over doing, nursing stuff, and they just kind of downplayed it and made it be a situation of, oh, it's just the nanny, or it's just the old nurse, the old
Old nurse in the
miss.
corner.
Right, and she's
Or
not
Black
there.
Ruby or whoever.
Right.
Like,
And then they turn around and take the same herbs and then start going and healing people magically. But we were the ones that were like witches and everything else. I just thought that was amazing.
and there wasn't a lot of history, so that recorded some of the Black nursing.
Right, in the books.
Yes, some of the actual expertise or skills or anything that they brought to the field. But I rest assured, I believe with this documentary, we are now laying that foundation and that framework for others to say, okay, well, these are some nurses that have been here that were part of the revolution in education and educating people about Black nurses. And the other thing that I took away that one of the nurses said in the documentary, she mentioned, we just do it different. Y'all know I'm always humming. They not like us. We just do it different. Like the way in which they care for people is different. The empathy that they have for people is different. And the patients recognize that and realize that. And it was just really just awe inspiring and just great to see. So I was glad I was able to participate in the premiere.
Another thing that I thought was amazing. That I thought was amazing was when they went to the historical society, when they went into the and it was so many books with all the information there, but nobody had learned about it. Like, nobody that ever went to nursing school knew anything about this stuff that was in all of these books that they were looking through. And I mean old books, like Jesus books. They were brown pages, people faces were ripped out of it, but for some reason that information just didn't come, it doesn't come over. Like, how does that even happen? That's just, I don't know.
She said Jesus book.
They are. It was like, for it not to be something that people know about, all of the nurses was like, no, we never knew about it. I know I didn't know about it, but I just thought I didn't know about it because I wasn't a nurse. But the fact that nobody knew about it, not even a nurse, was just, yeah, I was blown away by that.
Okay. But any other church announcements for the group of the anybody on online? You all have any church announcements? Anything y'all want to share? No. I know we got the delay. Okay. All right. I'll move on. All right. Well, let's spill the tea. So today we want to talk about are you built for this career? So again, as I was in the meeting and we were talking about the new way to assess folks, it really, something that struck a chord with me was, at some point we really need to assess early on, are people really built for this career? Like, don't waste people's time, money, energy, any of those things. Find out early on, and you don't necessarily need an assessment to do that, but arm them with the knowledge of really what this career is about, what this career is built on, and the foundation of being in health information. So being in health information, being in compliance, being a medical coder, and so we primarily talk about medical coding, but it's kind of the same. Like there are nuances, there are specific things about all of these healthcare careers that if you're not feeling it for real, don't play with it. Don't play with it. So some of the things that I saw or found about where you can kind of ask yourself, um, is this for me? You know, thinking about the work environment. Now, we don't necessarily have a lot of people um, in facilities as much as we did because of the virtual environment, but um, understanding that even if you are removed and you are virtual, you still have to have some sort of connection, even virtually, to um, your facility, like what type of facility it is, what's the culture of that facility. You still need to have some sort of knowledge or be integrated within that facility, and because you represent the profession. And again, even if you're not there physically, you should always be considered the resource because you manage the data of that particular facility. So people will call you or come to you or what is it? Teams message you or whatever while you're away, um, about information. And so we still have to not only do the jobs that we have to do, but then also, have a customer service centric purpose to the peers, our healthcare peers within that facility. Again, even though we are removed, so you still have to, make those connections and be in there. Um, Knowing, technology is, we all know technology has been here, but it's coming. It's coming for us and it's coming to us. And making sure we stay abreast of what the technology is available for us, how to use it. Don't be afraid with it, play with it, touch it, get in there and do some things. And knowing that as this profession morphs in the next few years, hell, we learning something new almost every day about technology coming through. But as it morphs, you want to be in front of that. You want to be proactive, not necessarily reactive. So get out there and play. They talk about all of these chat GPTs, and we learned a new GPT yesterday.
RAN,
Yes.
RAN,
So
GPT.
it's like, wait a minute, like it's a whole bunch of stuff out here. So you need to learn, and to take that even further, are you a learner? Are you a person that you're not one and done, like, oh, I got it and
No, it's
I'm done?
lifelong.
No, this is a career, a field where there is lifelong learn. And Mr. Justin, you can jump in at any time, but this is lifelong learning. Lifelong
Absolutely.
learning. And you got to know that that exists. And hopefully, I think we talked about this, particularly with coding, that they should go back to having those coding assessments so that you can really double down and make sure that people are indeed learning. So if you think about that Millers, so that they can, the does, we can see that they are doing it. They know it, but do it through those types of assessments. So hopefully those things come back as well for us, our seasoned coders, but even with our new ones, understand going in, just because you graduate or just because you get your certificate or just because you pass a certification exam,
Or
you
take the
don't
A off.
or take the A out. You're not at the end all be all, sweetie. There's more to know. You learn something every year. Think about, we get new codes, new guidelines, new all of the things. There's something to learn every year, and you can't be afraid of change, because change coming is coming, and you have to learn to embrace it.
And then even if you are a change, like you could be a surgery coder for 8 years. If you switch over to ortho, that's a whole new area. You're a newbie. You still know the basics. You're at the same level as somebody coming in that just had their A removed. You still have to learn. You still have to figure out how to apply that knowledge, because it's a different skill set, and that's why coding is a lifelong career, like a lifelong learning career. You have to keep your nose up in a book or or in front of a screen to stay abreast of all the changes, to stay abreast of anything that's new, because it's constantly changing.
You're absolutely right. You're absolutely right. And then, we have to think about whether you're on the AAPC side, whether you're on the AHIMA side, there are code of ethics. There is integrity that we have to walk in to do our job. Um, you know, it could be easy to be like, you know what, I don't even feel like looking for that extra code, or I don't feel like whatever. But what you don't do impacts the patient. At the end of the day, it impacts your customer. And making sure that you provide the quality, the accuracy, all of the things in this profession. So you have to have that type of mindset that, yes, I may not be physically touching this patient to help them, but I am helping them. I'm helping them to make sure that their information that goes with them throughout the course of their life is accurate. I'm making sure that the information that goes with them as it pertains to reimbursement is correct, so that the reimbursement is great, and they're not paying more than they need to, or they're not
Paying less than what they need
paying
to.
less, or even not being able to get insurance because of some documentation or lack thereof. So we have to also think about that portion of it as well.
And the fact that it's stuck on their record. So somebody can have an elevated blood sugar, but if you gave them diabetes, I mean, their whole thing in the background could just completely change, and what's covered and what's not covered. And when you think about long-term chronic conditions and how they make the reimbursement model for that for the next year, if that's not really what someone had, or vice versa, if they really had it and you didn't code it the right way and you gave them, just elevated blood sugar instead of diabetes, it just impacts everything as a whole, and it really affects how the providers get paid on the other side too.
Yeah. Another thing to think about, like, do you read the fine print? And I'm laughing because we'll get something that needs to be put together, and my husband throwing boxes, instructions, everything to the side and trying to put together. Sir,
With screws still left.
ma'am, and sir, man, I mean, it'll be put together, but you, and then, so I'll share this. We have a lock on our front door. Something happened to the other lock. I don't remember what happened, but something happened, so we had to replace the lock. Why is it upside down? The name is upside down. Of course, he hit me with, I'm left-handed, so it's to accommodate the left hand. Sir, everybody else here is right-handed. No, we're not doing that. I was like, you just know you didn't read it and it's upside down. Live in that.
Yeah.
Put it together. It's like, really?
I am an instructions reader. Even if I shouldn't, I'm like, and I hate the ones that just are pictures, because now what am I doing?
Do it.
Right. What am I doing? That drives me crazy. At least tell me what the little pictures are. Like, that just throws me for a loop. I give it to somebody else. I'm like, yeah, no, I'm not doing that.
She said that's my husband too. Wait a minute, let me see. She said that's, yeah. I'm like, sir, can we put it all together? What is happening? But yeah, so in our field, we have to pay attention to detail. We have to make sure we're reading that fine print. We can't gloss over, because there's knowledge, there's information in that fine print that can ultimately impact reimbursement, impact care, impact lots of things in the whole revenue cycle continuum. So yeah, you have to be somebody who is interested and pays attention to the details. All right.
And then be able to understand that you don't always get everything right. Like, sometimes, I mean, you still can get something wrong, and from there, you're only held accountable for when you know something and then don't correct it. Like, if you just didn't know, you didn't know. But in the reimbursement world, there's only so many times you could not know something before it turns into something like really, really big.
Right.
So
I agree. So here's some kind of discussion questions to think about. You can ask yourself, ask others. Um, but I'm gonna ask you all first. Like, what initially drew you to consider a career in medical coding or health information?
I actually
Wait,
want.
wait, before you answer. No, those of us in the meeting after the meeting know how she'll go down a rabbit hole. Man, don't rabbit hole us
Squirrel.
today.
I'm not. I'm
Squirrel.
not. I'm
Okay.
going to keep it
Okay.
direct. So I was going to go and be a MA. That's what I wanted to. My kids were in school, and I was like, I need something that is going to have us on the same schedule, kind of not working in the middle of the night. So I'll go to the school, and I'm like, yeah, I want to be an MA. And then it was like the prick, whatever that is, to draw the blood. I was like, oh, absolutely not, sir. Just stop. Well, you have to have so many pricks or something by the time you get to the end of it, and all the students in the class had to do it too. And I was like, I'm not lending my veins to these people who don't know what they doing. I was like, are you serious? And he was like, yeah. And we soon as we bent the corner, they were in there doing it. I was like, yeah, no. So let's stop. Let's go back because I need something different. I don't know what it is. He was like, ask different questions. I don't need to be on the front lines. And then he said medical billing and coding. I was like, well, what is that? He didn't even all the way know what it was. Put me in front of a little thing, and it was over from there. I mean, I figured out everything else afterwards, and I just haven't changed. I didn't know what it was before I knew what it was. So I kind of stumbled up on it.
It was the same for me. I was out of nursing. I was working as a barber, and I got an opportunity to learn HEDIS, and they taught us coding in the process, and that's how I got started.
Yeah, I had stumbled. Was going to school. I was like, I'm going back to school. I'm going to college. I'm figure out something. And then I started at a 2-year institution, and I was like, I want to be in healthcare because I've been around healthcare all my life. My mom worked in healthcare, um, and seeing the people and all of the things, and I knew immediately I didn't want to have any direct patient care. um but I was like, well, what about all of these other things? I see people walking around with papers, and like she looked like a secretary over there, and she's what's all of these other things. And having discussions with some of her friends that work in different areas of the hospital, I was like, okay. So when I got to the school, it was like, yeah, it's a whole area that kind of deals with the records. And again, y'all know I'm old and I date myself. The records, and how to file the records and how to maintain them and keep them, and making sure making sure certain documents go in certain places and all of that. So the person who was really explaining to me wasn't even well versed on coding. She just knew kind of the department and some of the things that actually happened in the department. And so from that, I was like, okay, well, that's something I know I can do, da da da. But once I got in and we started coding, I was like, oh yes, this right here, this is the jam. And so that's how I got into it. And then as the years morphed on, I'm seeing other things like, okay, I see a connection here. And so I got into compliance. I see the connection where having knowledge about even medical coding, because when we're doing investigations, primarily we need to know, well, what's the diagnosis, especially if we're looking at like, is something, is there, when we're doing a root cause analysis and trying to figure out, well, why did they not know they need to do XYZ for this type of patient? So in order to get enough data, hey, let's take this diagnosis, let's get so many charts, da 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 da. Well, if you don't know that diagnosis is connected to a code, then how are you going to even figure out how to get the charts to do that? So again, to me, it's all connected. And so that's why I'm still adjacent.
But isn't it crazy how we all three have different ways, but none of us knew? Like, why nobody knows? Like, that's really why I still do what I do, because why doesn't anybody know?
And I think there's a marketing problem. There's a awareness. There's not enough people talking about what it is that we do and how we do and why we do and what we can do. I think there's not enough advocacy about the profession and what people who have skills, what their skill levels are. There's a lack of, and it's, to me, it's very unfortunate. I mean, this profession has been around for years, hundreds of years. Why
I mean,
is
as long
that?
as there have been doctors, gotta be.
Why
'Cause
is that? Because they got to write something. They got to document something
as
about.
soon as the insurance has started paying, like somebody had to send something somewhere. It might
Yeah.
not be what it is right now, but and if I say I'm a coder one more time and somebody say, "Oh, IT," no, I'm not IT at all, at all. Like,
Well, I always preface it with medical coding so that they
well, now
don't
I
come
do,
at me
but you know,
with
sometimes
IT.
it's like, "Oh, you're a code. I'm a coder."
Because
What
they're
about IT
considered
and like,
coders.
But
yeah.
that goes to the whole marketing piece.
Correct.
That everybody talks about.
Correct. You're absolutely right. You're absolutely right. So think about, and I'm just putting some questions out there for you to think about. And if you all feel compelled to answer one, y'all can stop me and I'll let y'all answer. But think about, so how comfortable are you with learning and applying complex rules and guidelines? Y'all know that's something we do on a regular basis. Do you enjoy problem solving and investigating discrepancies?
That's me. That's my
That's
squirrel
that
area.
rabbit hole area. Squirrel. Wait a minute. How do you feel about the prospect of continuous learning and staying updated with industry changes? Can you? No, I'm gonna ask that. How do you handle working under pressure and meeting deadlines? Y'all know y'all got these um, quotas that they pretty much want you to feel in certain time frames. Are you comfortable working independently or do you prefer constant team interaction?
That was important because that's going to make a difference on whether or not you're home or you're looking for someone, you know, in the office, because they do still have those jobs out there. Like my daughter, she can't work from home. Like she has to have the interaction with people. She has to be like in a group setting. Me, I'm fine. Close the door and leave me alone. Come back later.
And so you got to really think about that because in a lot of our organizations, everybody is at home. There's those in the facility, in the place, things don't work anymore. They're not there. Um, how do you approach ethical dilemmas or situations where integrity is crucial? What aspects of healthcare or medical science interest you the most? How adaptable are you to new technologies and software systems? Do you see yourself specializing in a particular area of coding or branching into related fields like compliance? I did. How important is work-life balance to you? And how do you think this career aligns with your lifestyle goals? Oh, that's
Like the
that's
end.
a clip right there.
Yeah. Like what's the end goal? Like what is your ultimate outcome?
And I know we're talking, and let me put a PM right there. I know we're talking about actually, working in facilities or, working for organizations. But as we all know, entrepreneurship out here in our profession is real, real. And
And gate kept.
and taking your knowledge and your skills directly to a prospective client is where it's at. So while you're thinking about, how can I benefit or assist an organization in reaching those goals, if you are an entrepreneur, how can you take the skills and knowledge and what you have to benefit yourself and not necessarily an organization to reach your goal? So yeah, you have lots of options, and I think that was another thing that drew me to this particular field because there's so many options and so many paths and doors you can go down like a rabbit hole. There's so many things that you can go down and to find your niche, to say this is me and this is what I want to do and this is my lane right here. So and or if it becomes something that may change and that lane pivots, then okay, well, let me go down this door. But there are multiple channels that you can go down in order to be successful in this career.
And I don't necessarily think that in the beginning, when you first become a coder, you know that. If I think back to when I was in school, my professor slash mentor, she said that. She said, you're not going to know what it is that you like or do not like unless you try different things. So what does that really look like? I mean, that's really up to whoever. But I do suggest, you know, exploring, because that's the only way that you find out other different things. If you only do primary care, or gen surge, or you don't know if you're gonna like dental, you don't know if you're gonna like ortho, you don't know if it's gonna be better for you or more intriguing for you. So you have to put yourself in different situations to get those challenges to figure it out.
I agree. I agree. See, I can't see. I don't have two screens, so stuff be falling through the cracks. My bad. Right. So, um, lastly, let me just ask, so what steps are you willing to take to prepare yourself for this career path? So, we've kind of given you some food for thought. We've given you some areas to think about, to really, especially somebody new, or if you know somebody who is contemplating coming into our field, ask them these questions. Prepare them for what it is that they are really getting into, to determine really and truly, is this what you want to do? Is this what you built for? Are you built for this profession? Because you do see people who will get in and be like, oh, that ain't what I thought it was, or I can't do this or I can't do that, and then they leave. Um, and sometimes bad mouth it or whatever. But really, were you prepared to go in? Did you know what it all looked like before you got in there? So I think that's important.
But I think it all goes back to, well, not all, but it comes back to, well, it circles in and includes marketing,
Mm-hmm.
because we have so many. I know almost everybody that I've taught medical coding to, they all have said they had no idea it was that detailed. Almost every person says, "Oh, I just thought you just looked up codes in a book." It is so much more than that. It takes so much more knowledge. And it's like there's no mention anywhere about how complex these guidelines are. Nowhere. And you have to know guidelines for multiple code sets. It's not just one unless you work in risk adjustment. You have to know multiple. And you don't have to know them inside out, but you have to know that they exist. You have to know where to find them so you can
That's
apply it
right
to
there.
your situation. And that has to be taught. And so many people get in, and those are the people who I think leave because they're not willing to put in. It takes time to, I don't even say master, but to become comfortable
Mm-hmm.
with the guidelines and comfortable navigating these complex
At
charts,
least
because
proficient.
exactly.
You definitely have to be proficient.
And I just really think there needs to be more. I think people need to know more about it, how the intricacies work, and how A and B equals C, and how they're hard and fast rules that you cannot deviate from. It's not, I mean, coding is not about opinion or what you think.
I feel
Hmm.
And then you have to have a level of curiosity too. It's like,
almost nosy.
well, why? Well, why is that? Well, explain to me. Even with your superiors, or if you're coding something, or if you're looking at something and you're thinking, okay, well, this, and this equals that. Well, why? And have somebody explain that to you. And then, I always talk about the why behind that, because there's a whole big machine behind why it is that we have to do what we do, as it relates to coding in the revenue cycle. And so understanding that, yeah, it's a whole bunch of stuff, other players behind this, and what they're doing, but are you curious about that? Like, well, what exactly is that, and how does it impact me, and how does it actually impact the work that I provide? So yeah, there's a whole lot of
And even if you
skin in the
ask
game.
your supervisor, right? Because you might have some supervisors that just don't know. They just don't know. They just flip the book open and go wherever they're going, or they're scared that they don't want you to know because you might take their job. So whenever you get the answer to your why, that's where you have to have that inclination to say, okay, let me go research myself. Like, the internet is limitless for a reason. Like, you just go in there, you type it, you vet it, make sure you know where your resources are, and find and verify that answer. Because just because somebody is your supervisor, that does not mean that that's necessarily the right answer. I wouldn't tell them to their face, but I would go back and look it up to try to figure it out. And I mean, That's how I got onto the coding side, because just being in the billing and writing off stuff, it's like, why do I keep writing this off? Like, this doesn't make sense. Why do I keep writing this one code off? Like, why? What is the reason for that happening? And then at the end of the day, it was bundled or it was whatever the case may be. But if I never asked that question, I just would have kept going on with the way that they were doing it. And it was a billing company. Um, Sad to say, but they had no coders there. And so I didn't, in school they taught, we focused on coding but not a lot on billing, and the billing company itself like really let me know, okay,
Okay.
yeah, coders are investigators for sure.
Nobody told you to be reading it. See, she done fell down to go rabbit hole. So, good morning, Rami. I hope I'm saying your name right. Um, Good morning, all. How do you get into different specialties if you've only been coding for one specialty and you don't have experience in the other areas? Did you want to take that?
um I would say you can go on Indeed, right? Like you're not gonna know what area you want to go into, but let's say you apply to a different job. If you're at a hospital, that's gonna give you exposure to different things because they have them put in different pods. If you're at a doctor's office, a practice, that's a little bit different. You would have to come out of the private practice world and either go to another one that's a specific specialty, but you're going to be expected to just jump in and start going at a private practice. So I would say the best way I would think would figure out how to get into a facility, a hospital, because they have those sections, and you can learn different things, and your supervisor can put you over here and introduce you to this and introduce you to that. And then from there, you should be able to branch out and go a different place.
Well, I'm going to start out with, I'm going to start out with what you don't do. What you don't do is say I've never coded in such and such.
Right.
That's what you don't do.
Right.
What you say is I have been coding for XYZ and I'm looking to transition into this area because it's interesting. Then, but before you have that conversation, if it's outpatient, you go to that section. If let's just say it's endocrinology or let's just say cardiology. If you want to transition into cardiology, you go to the cardiology section of that CPT manual and read every code and you look up those procedures so you can at least speak to, well, I'm familiar because every coder will have transferable skills. Now they're not expecting perfection, especially because they're going to understand, oh well, you've done, whatever. But now you're moving into cardiology, and if you can speak to some of the procedures and at least have an understanding of what it is, like for instance, like knowing the difference between veins and arteries, which every coder already knows. So it's just becoming familiar so when you get in an interview you can speak to your transferable skills and have some knowledge of the new area, but don't go say I don't have any experience. Don't do that.
That was good. That was good advice. Um, I'm thinking also if you've gone through any type of training, then you've already been exposed to other areas. And you may have landed in a particular areas, but you've already, to your point, you've already been exposed. So dive deeper. Just, hey, let me find some additional case studies or let me find some additional um, charts or additional things that
Or YouTube University.
anywhere like to further my knowledge in that particular area. um yeah, because again, if you've been, prayerfully you've been in a great program, but if you've been in a program, they should have exposed you to other areas. So even if you were looking primarily at outpatients, so say or professional, you're doing AAPC and CPC type of work, and they are exposing you to that. But say you have an interest in inpatient. Well, one of the big differences in curriculum and training with professional versus inpatient is ICD-10 and PCS coding. So then you dig deeper into that. Well, let me take a deeper dive into these guidelines because they really didn't tell me this or talk about this. Let me what is this and what do I need to know and what do I need to glean for that? Because on the inpatient side, that's butter. Or PCS, I wasn't exposed to that. So what does that look like? Where can I find some additional information? So I would just think, do some additional independent study, if you will, on some of those areas to gain some proficiency in that.
And also, I'm in that same boat right now because like yesterday, I was my last day at my inpatient CDI job, and I am wanting to start to work with cardiology practices. Well, cardiology practices are outpatient. There are certain procedures that are never going to be done outpatient. So the knowledge that I have in PCS on the inpatient side is overkill for the outpatient side, but it's also
Welcome to
different.
CPT.
But it's also different, and since I have had have been exposed to CPT, now what I have to do is I have to go and reacclimate myself because I want to do cardiology and endocrinology. I have to go and acclimate myself to those procedures that are done outpatient.
That's right. That's right. You are absolutely right, cousin Anita. She's not my cousin for real. I don't know. I'm going by her last name. Coders are investigators. So Renita said, I was a biller for years in Texas, just kept questioning the coder manager. How did you get that code with no periods in it? It was CPT. She would just give me the answer. I was intrigued and desired to know more. Yes, yes. That's how you
See what I'm
get
saying?
it.
I'm telling you, people just they don't want to tell you stuff. She probably don't even know all the way know how she got to that
You're
got to those
welcome. You're
things.
welcome. Thanks for the advice, guys. You're welcome.
If you can't explain it, you don't know how.
You're right.
I don't know what this is, so we're not even going there. Oh no, I have no idea. But okay.
I
Yeah.
wasn't gonna scroll and say
Ma'am,
nothing.
I know you would because you was gonna figure it out. I'm surprised you ain't grab your phone and try to screenshot and then go do an interpretation or something, or interpreter or something. I don't know. But anyway, yeah. So we are at the top of the hour almost. Is there any addition? I'll say congrats, you are doing your thing. Yeah. I think that was for you.
Oh, thank you.
um. So yeah.
I got questions on the departure meeting after the meeting.
Oh yeah, y'all know the
Okay.
meeting after meeting about to be all the way
I definitely
live.
got questions.
We right here, ma'am and sir. So speaking of, let me just go on into our yes. All right. Speaking of the meeting after the meeting and all things Patreon, let me give you some information of what it is we're talking about. So, did you know that becoming a patron of ours, you're joining a community of individuals who share a deep appreciation for the intricacies of healthcare revenue cycle? And here's what you can expect as a valued patron and a member of none of y'all brought y'all tea sipper stuff. The tea sipper.
Listen, I do.
Okay, you got your tea sipper
Yep.
stuff. Okay, never mind.
Yes, I do. I did.
Look at the tea sippers. She goes on in the tea sippers merch. All right. You can gain exclusive healthcare insights by gaining access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. You get early access so you can be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. Here's your here to answer your questions and support your professional growth, as well as probably the best part, the secret sauce is the community connection. So join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So by supporting us on Patreon, the Tea Sippers, you're not only advancing your healthcare knowledge and career, but you're also contributing to that community of professionals in the field, depending on whether you're new or seasoned. We all learn something from each other all the time. And, this allows us to not only advance ourselves, but advance each other. So, and then assisting with the success of Professional Reimbursement Network, which is a resource that empowers healthcare professionals like you to thrive in their roles. So, thank you for considering becoming a patron, being a tea sipper. Yes, yes, yes. You can check out the link in the description of the video or go to patreon.com/Clarice Warner, the girl with the pearls. Your support means the world to us, and we look forward to helping you excel in the world of health information. All right, y'all. Yay.
Yay.
We did it. All right. So, very cute. Okay. Oh, she said very cute, but your shirt. Thank you again for joining the Saturday morning tea or checking out the replay. Was the tea spilled today? If you felt the tea was spilled, make sure you put your teacups in the chat. Put your well, we can't put our teacups in the chat. Put your teacups in the chat. Yes, yes, yes. Mr. Jesse, do you have any last final thoughts or words?
No, I'm just glad we could do this live. We might have to take it on the road and come to either Florida or Cincinnati. Okay.
Right.
Oh, come on to Cincinnati. Yeah, but we gonna play. Y'all come to Cincinnati. and our on the street correspondent, you live. I think this is the first time you've been over in the Saturday morning tea.
Yep.
Any thoughts or any final?
No, I'm just thankful to have and be in the vicinity of people of like mind and just the support. And I just think it's a good thing because it's something that you just don't always have. Sometimes you're just out there, out there flopping around like a fish trying to figure it out. So I like the fact of, yes, between squirrels and flopping fish. Just to not be, out there winging it and knowing that you have somewhere to go to ask a question without being judged, because I think that's the biggest part of it. Sometimes people don't ask questions because you don't know how somebody is going to take it or how somebody is going to treat you because of that question that you ask. So thank you for having the platform.
Yeah, you're welcome. You're welcome. You're welcome. If this information was valuable for you, help us to share this message with others by sharing the video and subscribing to the channel, Professional Reimbursement Network. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave, don't forget to hit the thumbs up or like button. Also, check out the Coding Nurse channel on YouTube. You on YouTube? You on Instagram? Where you want them to check you out?
I am on all platforms
As
the Crafty Coder.
Check out the Crafty Coder on all platforms to get more information on all of the things happening in the rabbit hole.
Yes.
So this has been a great session today. Our live session, we finally did it. Yeah. See you tea sippers at 10:15 a.m. That's when we have our meeting after the meeting. If you would like to join us, don't forget to go out to Patreon and come on over to the side and pull up your tea and get ready for some belly laughing, but also some information. Okay. Yes. So again, thank you for joining, and remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. Bye.